I'm Sarah. I'm one of the PAs working here at General Physician Gastroenterology. I see patients in the hospital as well as in the clinic for a number of conditions including acid reflux, irritable bowel syndrome, and inflammatory bowel disease like Crohn's disease and ulcerative colitis. We use a number of diagnostic tools here in the office. Most commonly, we use a colonoscopy, and that's what I'm going to talk to you a little bit about today. The reason we stress this so much is because colon cancer is highly treatable if we find it early. That's why we want you to have regular colonoscopies starting at the age of 45. The reason we stress this so much is because most cancers can be treated if they're caught early. We can detect polyps or precancerous growths, and we can remove them before they turn into cancer. That's why we stress the importance of colonoscopy so much. A lot of people think that a colonoscopy is scary or that it's going to be really painful, but the truth is that it's very well tolerated. You're completely asleep for the entire procedure. We just ask that the day before you maintain a clear liquid diet and that you do a colonoscopy cleanout, which I'm going to talk to you a little bit about today. So the prep for the colonoscopy actually takes place about 4 days before your actual procedure. Now that doesn't mean you're going to be running to the bathroom all week, but what that means is that we want you to avoid certain high fiber foods and stop certain medications like aspirin or other blood thinners. A few days before, we ask you to avoid certain dairy products. The day before your procedure, we want you to maintain a clear liquid diet. That means broth, juice, and we want you to maintain that while you're taking your colonoscopy prep. The day before your colonoscopy, while you're drinking your clear liquids like broth and juice, we want you to take 2 Dulcolax tablets. After that, we're going to ask you to mix in Miralax into 64 ounces of Gatorade. You can choose your flavor, but we ask that you avoid red and purple so it doesn't skew the results. The day of your procedure, about 4 hours before your colonoscopy, we ask that you drink the 10-ounce bottle of the magnesium citrate. 3 hours before your colonoscopy, you can take any of your morning medications with a sip of water. But after that, we ask that you refrain from drinking or eating anything until the time of your colonoscopy. If you're a diabetic, I would avoid taking any of your diabetes medications the morning of your procedure. So the procedure itself is probably about 30 minutes or so, but plan for about 3 hours of time that day because we need to get you checked in, and then after the procedure, as you're coming out of the anesthesia, we want you to stay in recovery for about an hour. Because you just came out of anesthesia, you're still going to be a little bit groggy. We don't want you driving home in that state, so we ask that you arrange for some transportation to take you home. After the procedure, you can go back to your regular diet. We'll have most of the results available to you right after your procedure, but if we've taken biopsies, that takes a few days to come back. So we'll be sure to notify you of the results, or you could check your general physician portal. And really, that's all there is to a colonoscopy. So don't hesitate to schedule yours today. All of us here at General Physician Gastroenterology are here to walk you through the process and answer any of your questions. We have many office locations, and we can find a location that's convenient for you, or we offer virtual appointments. Again, I'm Sarah here at General Physician, where we care about your health.